We're going to start with the bony prominences of the elbow. First is the medial epicondyle. It's going to be distal and medial the prominence of the humerus. So you're going to start, and it's going to be the bump right there on the medial side. Then the medial condylar line. It's the ridge just superior to the medial epicondyle. So you're going to start on the medial epicondyle and palpate superiorly. It's going to be right here.
I think you're supposed to be filming that.
And then you're going to do the olecranon, which is superior to the ulna, and it's located on the posterior side. So it's just going to be very prominent. It's going to be what is considered the elbow. Then the ulna, you're going to start on the olecranon and palpate inferiorly down to the hand. And then with the olecranon fossa, you're going to start distal end of the posterior humerus, and it's in between the epicondyles. So you can feel it better when you have them flex the elbow. You can feel it in between the epicondyles.
Maybe palpating the radius, and the radius is on the thumb side. So you start distal to the lateral epicondyle, and you run down the arm to the hand. The lateral epicondyle is right here. It's a little bony mark on the outside of the arm. The lateral supracondylar line is just superior to the lateral epicondyle, so you find that and you go just superior. The proximal radial head, you have the patient going to 90 degrees of elbow flexion, and it's 1 inch distal to the lateral epicondyle. So we feel it like that.
All right, to start with the soft tissue. Okay, we're going to start with the ulnar nerve, which is between the medial epicondyle and the olecranon, and it's easier to feel if you have them kind of flex, and it's in between this groove right here. So you'll feel the groove, and it's right in there. Okay, then the medial collateral ligament, it spans from the medial epicondyle to the ulna. So it'll be right here, but you won't be able to distinguish it. Okay, then the pronator teres, it is, if you have your hand like this, then going from here, from the thumb, will point to the pronator teres, but you will not be able to distinguish it from like palpation. So this will give us a point from where it is. Then the flexor carpi radialis. If you keep your hand like that, then it will be the index finger on the hand will point to it. And if you have them make a fist, not a wrist, and move the wrist, you can kind of feel them become more distinguishable up by the wrist. So, and with the palmaris longus, it'll be the middle finger when you have them do this. And again, when you have them make a fist and kind of move the fist, you can see it bulge out from down here. And this will be the same thing with the flexor carpi ulnaris. This will be your ring finger, will be pointing to it. And when you make the tight fist, then you can palpate the proximal to the pisiform, and it'll be down there. Okay, the supracondylar lymph nodes. So you're going to palpate along the supracondylar line, and so it's going to be back here. And this is normally undistinguishable, except for there are times when they get lumps and they feel slippery. But other than that, when you're normal, you can't really feel them.
This one is the brachioradialis. So you have the patient make a fist, and then they're going to lift up on my hand, and it's this muscle that bulges out right here. The extensor carpi radialis longus. To find this, you also have them make a fist, and you resist wrist extension. And the muscle tone will be noticed at the second and third metacarpals, and then also at the lateral epicondyle. So for this, you can kind of feel it, but it's not really distinguishable. The extensor carpi radialis brevis, you do the same